Hello and welcome to my presentation on Formulate, a diagnosis and treatment recommendations for borderline personality disorder. My name is Cecilia Dunn and I will be your presenter. This agenda will be going over a case summary of an individual who has been diagnosed with borderline personality disorder. We will go over a diagnosis of borderline personality disorder, other tools that are used to diagnose, the 5 domains of Garcia and Petrovic's diversity resilience formulation, which includes intrapersonal, community, spiritual, and diversity, and how each of these illustrated in the client's vignette, a summary of the current evidence on causes of the condition, recommendations for individuals with couples and family therapy, best current medications and biomedical interventions that are used to treat the condition, ethical issues that may be present with this diagnosis, ways in which I and other therapists can collaborate with other members of the treatment team, potential self-care issues that may be present in working with this diagnosis, followed by a summary and references. Okay, so we're looking at the case of Marianne Santos. She's a 33-year-old from a middle-class Hispanic family. Marianne has lived in the state of Washington since she was 6 months old, and Marianne was referred to therapy by her general practitioner who noticed cuts on her wrist. Marianne states that she has been in psychiatric care before, in fact 7 times in her life, and was diagnosed with depression in her teens. Symptoms she's experiencing are feelings of depression, feeling empty inside, impulsivity, and volatility since she was an adolescent. She's had a total of 4 suicide attempts and self-mutilating behaviors, and she drinks excessive amounts of alcohol in the last 14 years. She states that she doesn't know what's wrong with her and wonders if it's more than just depression. She has not found the right treatment in the course of her psychiatric care, and in the last 6 months, Marianne states her feelings have gotten worse and she's been isolating at home. She doesn't know what she's going to do if her feelings do get worse, and she admits to not taking her prescription medication that her last psychiatrist wanted her to take. Marianne has moved back home after breaking up with her last boyfriend. She told us that she thought he was wonderful at first, but after she found out that they had different views about certain things, she felt that like she hated him. Marianne copes by drinking excessive amounts of alcohol daily and states that it is hard to pursue a job right now or get close to people because she struggles with feelings of dysphoria and just feeling as if everything she does is wrong and is easily angered. She says it's like a switch and it's just too much to bear some days. Marianne's family history is that her parents and older brother came from Mexico when she was just a baby, and she only has one sibling who is a male. Marianne stated that her father has never been diagnosed with any conditions, but that he also experiences extreme mood swings where he acts nice and then the next minute reacts with anger or sadness over little things. Marianne states that she was verbally and physically abused growing up, and that both her parents are invalidating of any of her accomplishments, especially in how she got herself through junior college and in supporting her dreams of being an artist. She feels that she has let her parents down mainly because of cultural expectations and what she feels her parents expected of her to be as a woman in her culture. She feels as if her brother gets all the care and attention that she did not receive growing up. she is not close to her father and brother, but still has a relationship with her mother. Marianne has 3 boyfriends in the past few years and states that she moved in with them but doesn't let them get too close to her. Eventually, she ends the relationships before things get too serious, which Marianne indicates is about 6 months to a year. She admits to cheating on boyfriends by having unsafe sex with random men when she wants her fix, but explains that it's not that bad because sometimes guys give her money and the money helps pay bills. During the initial interview, Marianne seems that she is clean and groomed. Her hair appears wet and pulled back. She seems coherent and willing to talk. Her mood seems dysphoric. However, she seems irritated with questioning about her relationships with boyfriends and strangers. She did smile appropriately more than 6 times. So we're looking at what is a thorough diagnosis of borderline personality disorder. Well, to make a thorough diagnosis of borderline personality disorder, the therapist would need to gather as much information as they can about the client, such as assessing what the client's main concerns are, their life history, and symptoms. In addition, the therapist wants to look at what treatments the client has already tried. It is imperative to have the client obtain a physical examination and to undergo also a psychological evaluation. Secondly, a therapist would begin to go through the symptoms of the client that the client has reported to determine whether they match any mental disorders listed in the DSM-5. Other disorders may be diagnosed, especially when other symptoms are co-occurring. Also, to look at the severity of these symptoms that are occurring. So why do I believe that Marianne Santos has borderline personality disorder? In assessing Marianne Santos' symptoms, a therapist would find that Marianne, who is now 33 years old, began having these symptoms during adolescence. She was diagnosed with depression. However, she has other symptoms that are very problematic. Looking at number 1 of the DSM under borderline personality disorder, it explains that someone with borderline personality disorder would try to avoid feeling abandoned, and whether it is real or imagined. This may explain why Marianne has been avoiding people and isolating. 2. There is usually a pattern of unstable and intense interpersonal relationships, which might explain why Marianne, with her boyfriends, but firstly moving in with them and then getting out of the relationship before things get too serious, as she explained. Number 3 states that the criteria that someone would display a constant unstable sense of self or self-image, and this is one area that I feel might be unclear about Marianne. Number 4 states that the individual has impulsive behaviors, and I can see that Marianne is impulsive in the way that she has self-mutilation behaviors and in having reported having sex with strangers on the whim and over drinking. Number 5, does Marianne display recurrent suicidal behaviors? I can see that Marianne is still harming herself, and having been referred to a therapist, she has reports that her feelings are becoming worse, and she's not sure what's going to happen if they do worsen. Number 6, Marianne does display instability in her moods, as she states that she's feeling dysphoric. She worries at times that she's doing everything wrong, and also has anger, though it is unclear how long her mood can last. Number 7, Marianne did report feelings of emptiness. Marianne did report feeling intense anger that can occur like a light switch, though it is unclear if she is engaging in physical fights, temper tantrums, or fits of rage. Number 9, it is unclear whether Marianne has paranoid ideation, though she does not want to get close to people that she's in a relationship with, such as boyfriends and her parents. Number 10, in order for Marianne to meet a diagnosis, she must meet 5 of these symptoms out of 8, and I believe that Marianne meets them. Tools used to diagnose borderline personality disorder. A therapist may also have their client complete several diagnostic instruments, such as a personality questionnaire, the McLean screening instrument, the DSM-5 screening for personality disorders, and the Minnesota Borderline Personality Disorder Scale. Diagnosing someone with borderline personality disorder are traits and symptoms that are going to be present across one's lifespan. It is most likely that the client is not going to get a diagnosis of personality disorder in the first session. It takes time to gain an understanding of the client and how they are affected by these pervasive disorders. So let's take a look at the 5 domains of Garcia and Petrovich and how each of these are illustrated in the client's vignette. It is imperative to look at these factors in order to accurately diagnose and understand clients. Diversity itself looks at how the mental health professional as well as explains how clients describe their symptoms and communicate what it's like to have their symptoms. Adding the 5 domains into the DSM and diagnostic process gives the clinician a more efficient way to understand how their client can be resilient, as well as providing information on how they are affected emotionally and mentally. In the DSM-5, it presents symptoms of disorders. However, adding in the diversity and resilience formulation gives therapists a more complete picture of their clients' abilities, talents, and areas they should have pride in and achievements. As an example, Marianne Santos' information on what achievements she's accomplished, such as continuing to have a close relationship with her mother, are important interpersonal factors. Interpersonal factors to consider would be that Marianne has accomplished graduating junior college. She has also set a vision to pursue her passion as an artist. Community factors reflect relationships she has had with others, such as friendships and how she communicates with people around her. Spiritual factors would include Marianne grew up following Catholic traditions but no longer follows the religion as an adult. Marianne enjoys the aspects of art, and art can be a reflection of one's spirituality. It reflects spiritual principles such as beauty, creativity, and gives an individual the ability to express their feelings and perceptions. Diversity factors include cultural factors as well, and using the cultural formulation interview. The cultural formulation interview looks at how the roles of one's cultural identity can affect how the individual sees their condition and how they are likely to cope with the problems and resources they have used. In Marianne's case, she has stated not feeling that she was important as her brother, and as if she has let her parents down because she's not conformed to gender expectations in her culture. Looking at how the client has coped, it is clear that Marianne has not coped well in her life, and she has chosen many self-harming behaviors as well as a way to dull and numb the pain she's experiencing. Marianne has mentioned seeking psychiatric help in the past for her feelings of depression, isolation, and self-harm. Current evidence of causes of borderline personality disorder. Borderline personality disorder is caused by a combination of genetic, neurobiological, and environmental factors. Studies have shown that some individuals have a genetic vulnerability to having borderline personality disorder. In 2013, researchers found a gene variant known as ADRA2B, which has influence upon the neurotransmitter epinephrine. It is also linked to regions in the brain that affect elevated states of emotion. People with this gene experience emotional acuteness. Neurobiological effects. The HPA axis, which is part of the neuroendocrine system. It is an area of the brain in charge of regulating stress that we experience and normal experiences. The HPA axis produces a low level of cortisol, which brings our bodies back to a homeostasis. However, in people who regularly experience stressful situations such as trauma, their bodies are releasing high levels of cortisol, a steroidal hormone. High levels of cortisol have shown to cause a cascade of problems within the body, such as the risk of developing psychiatric disorders as well as experiencing an array of physical illnesses. Looking at environmental factors, we find that an early attachment experiences help individuals to learn what they should feel emotionally. It gives children the ability to understand how they should regulate their behaviors and how close they should get to others. It is thought that children with insecure attachments or who have endured trauma, maltreatment, and temperamental attributes, they have a higher chance of having more severe symptoms of borderline personality disorder. Children who have endured abuse while growing up may experience borderline personality disorder as well as multiple comorbidities. Symptoms of borderline personality disorder are thought to affect the individual early in adolescence and do not abruptly begin in adulthood. Researchers have also found that areas in the brain such as the amygdala and insula are operating in overdrive while the prefrontal cortex and anterior cingulate cortex may be underactive in regulating emotions. A person who has been exposed to insecure attachments could be at risk of seeking other unhealthy relationships as they grow older, and that may lead the individual to see themselves in a very negative way, such as feeling as if they are unlovable and undeserving, as well as feeling as if people cannot be fully trusted. Furthermore, they fear abandonment as they get into relationships with others. Recommendations for couples and family therapy. Dialectical behavior training is a recommendation. Mentalization-based therapy and transference-focused psychotherapy. So let me tell you about dialectical behavioral training. It was created by Marsha Lineman. This modality of therapy addresses symptoms in BPD by finding ways to change behaviors to healthier choices to cope. This form of therapy can be done on an individual level as well as in a family setting. DBT encompasses mindfulness, emotional regulation, interpersonal communication skills, as well as distress tolerance. Traditionally, DBT has 4 structured skill training sessions. Therapy sessions include a telephone consultation followed by a meeting with a therapeutic team. DBT is also recommended in comorbid disorders such as substance use, depression, and eating disorders. DBT teaches skill building to those who are experiencing chaotic relationships, fearing abandonment, and feelings of impulsivity. The therapeutic module usually lasts about 6 months to a year, and the therapist may even have the client repeat this treatment. Mentalization-based therapy is an individualized therapy which teaches clients with the notion that they are unable to mentalize their thoughts, emotions, motives, desires, and in understanding the things they need. There's a belief that the client lacks awareness in themselves and in others. Problems arise when the attachment to a loved one is interrupted. Individuals who are undergoing this form of therapy will usually have one therapy per week, as well as one group therapy session per week. The treatment time is 1.5 years to 18 months. Transference-focused psychotherapy is a psychoanalytical approach which bases therapy on the hypothesis that the individual does not see themselves or others in a positive viewpoint. They struggle with splitting and do not see themselves or others in a balanced way. Treatment involves clients reenacting how they feel about themselves and others while offering help and support to reach a point where they can become more emotionally integrated. Therapy usually improves sessions, and the sessions are usually twice weekly and several years. Looking at hospital treatment, if the patient is suicidal or exhibiting acute psychotic symptoms, they should seek help right away. However, in cases where the patient is seeking help for feeling down, it is best not to be admitted to a hospital. It is best if the client is referred to an outpatient psychiatric intervention for various reasons, such as allowing the client time to cool off, or especially in cases where the client may not want to lose their means of employment or responsibilities. Best current medication interventions used to treat the condition. Currently, 90% of borderline personality disorder patients are given psychotropic medications to treat symptoms. However, despite the fact that professionals prescribe these medications, there is actually no medication that was made to treat borderline personality disorder. So best current medications used to treat this condition. Pharmacological approaches are not a primary approach in treating borderline personality disorder on its own, but when they're added to a clinical management system, they can be effective in treating symptoms. The clinical management system uses methods of treatment which include psychopharmacological and psychotherapy methods. In using psychopharmacological medications, a psychiatrist will likely prescribe medications from one of 3 classes of medicines. 1. Mood stabilizers and anticonvulsants. 2. Antidepressants. And 3. Antipsychotics. Mood stabilizers includes, in this class, are lamotrigine, valproic acid, and topiramate. Also oxycarbazepine and lithium. These medications can be effective in decreasing symptoms of impulsivity and dysregulation of emotion. Antidepressants used are fluvoxamine. Some antidepressants used are SSRIs and MAOIs. SSRIs and MAOIs help decrease anxiety and depression. Next, we have antipsychotics prescribed, which include clozapine, olanzapine, quetiapine, risperidone, aripiprazole, and acenapine. Ethical issues that may be present with this diagnosis. 1. It's important to let the patient know of their diagnosis early in treatment. A therapist can guide their client with information and do diagnostic review to help make sense of what they are experiencing. 2. It is imperative to address symptoms that are the most pressing in borderline personality disorder, so that the client knows what symptoms could arise. As an example, the therapist may want to discuss the risk of suicide with the client. Mentioning this information may help the client to communicate their fears about suicide, which may cause the fear to lessen over time. 3. Early in treatment, when the therapist is explaining the informed consent with the client, they should also allow the client to know when they are available to call them. They should inform their client of what can be discussed over the phone, hours of operation, and when they should expect a call back. A therapist should inform their client what will happen if they call in the event that is an emergency. That way the client does not feel as if they are being ignored or rejected in their time of distress. This is a way to effectively establish boundaries with the client. What should a therapist do if they believe their client should be hospitalized, but the client does not? Again, these are serious topics should be decided upon early in treatment. If the therapist is unsure of how to approach a client who they believe should be hospitalized, it is most effective to collaborate with other colleagues who may help determine the right course of action to take for the client. A therapist should also discuss with their client when they have to refer out to a specialist or another counselor, so that the client does not feel fear of what could happen or other feelings such as rejection and abandonment. Ways I will collaborate with other members of the treatment team. A treatment team should share their perspective, especially in using DBT. The therapist and other mental health professionals may come together once a week to discuss how the client is progressing in therapy, especially if the client happens to be suicidal and is harming themselves. I would want to come together with other members of the treatment team as a way to continue to stay motivated, to share skill sets we have and knowledge with each member. We know we cannot force change as therapists, but we can become more empathetic and accepting of the client and her progress. Potential self-care issues that may present with working with people with this diagnosis. It's important overall that a therapist maintains their awareness about burnout. Burnout can occur when a therapist does not take care of themselves and they're faced with overwhelming stress and emotional fatigue. The therapist who is experiencing burnout might be unable to detach from the client's case, taking calls from clients after work, or talking to the client every time they have a crisis. Burnout is common for a therapist when they are working with clients who are suicidal, depressed, or express aggression. A therapist must make sure to take care of themselves daily by making sure to get enough rest, eating healthfully, and utilizing relaxation techniques. It is also imperative to leave work at work, making sure to inform the client of the hours they are available and trying to not violate ethical boundaries. In this report, we looked at the case of a client named Marianne Santos. She has been diagnosed with depression, but later looking at her case, she has borderline personality disorder, and we looked at how a therapist would take steps to diagnose Marianne with, like what criteria Marianne's symptoms must fall under, as well as other diagnostic tools used in diagnosing borderline personality disorder. We looked at what causes this personality disorder and what treatments are used at this time. It's important to follow ethical procedures and to inform the client of their informed consent and self-care a therapist must take in caring for clients who have pervasive disorders such as borderline personality disorder. Thank you for watching my presentation, and here are my references as well.